Thank you, Mr. Chairman. Dr. Robertson, my state of Oklahoma has been hit particularly hard this year. According to Walgreens, that Oklahoma City is the #1 place for prescriptions to be issued out for Tamiflu. Tulsa's #5. I think we've had somewhere like 50 deaths and in the neighborhood of 1,300 individuals being hospitalized. My family was hit real hard this year. Out of my 5 kids, 4 got it. My poor daughter, who's 6, received actually 2 different strands of the flu. My wife and all my family missed the swearing in because of the flu. And now it's kind of ironic that I'm sitting up here talking about this. Just some follow-up questions. My understanding is part of the challenge of being able to respond to the mixed match vaccine is the burden of regulations, but underneath declaration of maybe an emergency, those regulatory burdens change. Is that correct?
Certainly, if a public health emergency is declared, then we can move forward, but there are regulatory issues that Dr. Mithun may want to
No, I just wanted a yes or no on it. If it's declared an emergency, those regulatory burdens change quite a bit, right? Okay. In 2009, the president declared a public emergency during the swine flu or the H1N1 crisis. That's correct, right?
Correct.
How many cases of swine flu had been confirmed, not deaths, but had been confirmed in the U.S. when the president declared that public emergency?
I think Dr. Shuckett could answer that.
I don't have the numbers, but there was
It was 20.
enormous change
It was
in the
20.
epidemiology.
We do have the number. There was 20 of them that was in there.
Well, but instead of flu coming down, it was going up after the season with a
Right.
completely different strain. So
But there was an emergency declared with only 20 confirmed cases in the U.S. There's already been 50 deaths in just my state of Oklahoma. Mm-hmm. So I'm trying to make a comparison here. I believe this flu season goes through May in the Northern Hemisphere. Is that correct?
It can extend to May. It can end earlier.
Okay. What exactly is the definition of public health emergency? Dr. Robertson, you want to take that? What's the criteria of us meeting a public emergency?
Yes, a public health emergency is not a black and white definition.
So there's no set of specific criteria that we can look at, like the number of deaths or hospitalization, to determine what is in the public's best interest as far as a health emergency?
The issue with a pandemic is that the potential impact is exceptionally greater than the normal range.
So it doesn't matter how many deaths we have, it's just 100% up to the CDC to make
one would
that.
be declaring that much in advance of seeing the deaths because of the time needed to take steps to intervene.
Would it help if Congress or you guys could come up with maybe some criteria that we could look at that could maybe trigger it rather than just waiting for the next crisis to happen, or honestly, a public outcry?
I think we could probably provide the language about a public health emergency. What I was trying to say was that it's not the same for each condition, for each disease or.
I understand there's some type of flexibility, and there's got to be a little bit of more understanding of what we're dealing with. But it seems odd that there's no criteria at all for us to understand it when something like the swine flu that just had 20 cases in the country was declared an emergency by the president, and yet we have a pandemic going on right now with the flu, and we could have maybe changed some of this with the regulatory burdens going through if we would have declared it an emergency faster, or maybe we could have got help to individuals.
In 2009, a new strain emerged from animals that had genetic reassortment that was completely unique to humans. And so what we're dealing with the drift is slight changes, a very different scenario. But what you indicate is correct, that the ultimate burden of disease from a drifted H3N2 strain may end up being greater than a completely new to humans reassortant like the H1N1
So
swine
could-
origin pathogen in 2009.
Could you maybe help us, maybe draw some type of criteria that needs to be laid out? So the next time this happens, we could have something to compare it to?
We'd be happy to provide follow-up on the public health emergency and how that's defined.
Thank you. I yield back.